If there, by some reason, we're going to get hyperpigmentation, we have to usually think that that's most often going to be a post-inflammatory hyperpigmentation, so PIH. So it is a result of an inflammatory process. So sometimes this may occur if there's been improper care for the procedure afterwards or something that created inflammation in there. So the last thing we really want to do is go in there and do something that's more inflammatory. And so you have to be really careful. People want to treat it quickly, but by going in there creating more inflammation, you actually may exacerbate the problem. So most commonly, time is going to be on your side. If you have somebody that's a very high risk or you're concerned with it, there are some protocols that you can do beforehand. You can put them on hydroquinone to suppress the melanin production from the melanocytes. You usually put them on for at least 2 weeks and have them off for at least 5 days prior to treatment. And so that's one of the ways. I really, advise not doing it on tan skin. And so we live in Florida, so I want patients to avoid the sun and make sure they're wearing sunscreen, wide brim hats, things like that prior to the treatment. And so if they come in and they just had a weekend at the beach and I can look at them and tell that they're tanned or red, then I don't treat them. I reschedule their treatment. I'm okay with doing like a Plexr shower. And again, we can talk about that in another, setting, but I don't do the cat scratch or a more ablative treatment on sun tanned or sunburned skin. So sun avoidance for at least 2 weeks prior to the treatment is going to minimize that. If they're, high risk, so some of your darker skin types, then I think hydroquinone, and I just use a 4%. You can combine that with or without retin-A. That will help penetration of it. Some of that, there's some evidence to show that that will decrease it as well, but they're going to be a little bit more reactive. And some people don't like the side effects of, kind of short-term higher dose retin-A. And so I tend to leave that out of my protocol and go just with hydroquinone 4%. Again, for a 2 week period, stop 5 days before. But in all honesty, I rarely use that. That's somebody who's told me they're scared of it. They've had PIH before or some problem. For me, I'm saying I'm going to use the protocol and the training appropriately. I'm going to have them avoid the sun for 2 weeks, and we don't have these type of problems.